Hey, this is Not So Complicated, presenting you on 5 minutes 5 high yield drugs of episode 2 that includes respiratory drugs like albuterol, fluticasone, ipratropium bromide, montelukast, and omalizumab. So let's begin without further delay. So the albuterol, it belongs to the class of short-acting beta-2 agonist SABA, and the uses are acute asthma, COPD, that is chronic obstructive pulmonary disease exacerbations, right? And then the mechanism is that it stimulates beta-2 receptors that relaxes bronchial smooth muscle, thus improving the airflow. The side effects of this drug are tremors, tachycardia, and hypokalemia. There are a lot of side effects, but you have to remember these three specifically. And the USMLE Pearl is that it is the first line for acute asthma attacks, and it is also synergistically used with ipratropium bromide, right? The overuse may reduce efficacy, and also the example of this case, like this drug uses, is that the asthmatic patient with wheezing gets albuterol nebulizer, that is in metadosinnular, for rapid relief. The other drug that we have is fluticasone. It is inhaled corticosteroids. The class of it is that ICS, and the uses are asthma maintenance and also in allergic rhinitis. The mechanism of action is that they inhibit inflammatory cytokines that reduces airway inflammation and hyperresponsiveness. The side effect of fluticasone is that oral thrust can happen, dysphonia, and also rare systemic effects like adrenal suppression can happen, right? So USMLE Pearl is that you have to rinse mouth post-use to prevent the thrust. This oral thrust is due to MDI, right? So the fluticasone, by the use of fluticasone, you have to rinse your mouth post-use to prevent that kind of thrust, and also not for acute attacks. The example are chronic asthma patient uses fluticasone inhaler to prevent exacerbations, right? The other drug we have is ipratropium that we have talked earlier with albuterol. The class it belongs to is short-acting muscarinic antagonist, and the uses are COPD, acute asthma with albuterol that we talked, and the mechanism of action is that they block muscarinic receptors that reducing bronchoconstriction and mucus secretion. The side effects of this is dry mouth, blurred vision, and urinary retention, right? And also the USMLE Pearl is that it is synergistically used with albuterol in acute asthma, and it is also preferred in COPD, chronic obstructive pulmonary diseases like bronchiectasis, chronic bronchitis, right? And also the example use of this drug is that COPD patient with dyspnea. Dyspnea is difficulty in breathing, uses ipratropium for bronchodilation. And the dilation of bronchial system will allow you to breathe freely, right? The montelukast is the other drug that belongs to the class of leukotriene receptor antagonist. The uses of this drug is that asthma maintenance and also in allergic rhinitis, and the mechanism of action is that they block leukotriene D4 receptors. Leukotrienes are actually the inflammatory mediators of any inflammation, and in asthma leukotriene D4 has a very large impact, right? So the blocking leukotriene D4 receptors will allow you to reduce bronchoconstriction and inflammation. Since inflammation is below long-term related to fibrosis, that will lead to permanent permanent narrowing of the bronchioles, right? So we have to reduce the inflammation too. That is why montelukast is used. And the side effects of this drug is that headache can happen, and rare neuropsychiatric effects like mood changes can occur. And the USMLE Pearl is that it is oral and thus not for acute attacks, because since every oral drugs are not for acute attacks, right? So because of a high time of metabolism, and they are useful in aspirin exacerbated respiratory disease. You have to remember this. The example case is asthmatic with seasonal allergies takes montelukast for prophylaxis. The last drug we have is omalizumab. Omalizumab is anti-IgE monoclonal antibody. The uses of this drug are in severe allergic asthma uncontrolled by steroids. So if they are uncontrolled by steroids, so you use omalizumab. The mechanism of action is that it binds with free IgE, thus prevents mast cell degranulation and reducing allergic airway inflammation, right? The side effects are injection site reactions and also anaphylaxis in rare cases. The USMLE Pearl for this drug is that for patients with high IgE levels, obviously. And also we have to monitor for anaphylaxis post injection. The example case of this drug is that severe asthmatic with with high IG starts omalizumab for better control. So that is all for today. Subscribe for daily doses like this, and thank you for staying with me until now. You can also share for other